Are you aware that roughly 1 in 3 people who suffer a transient ischemic attack, also known as a TIA or mini-stroke, will later experience a full stroke? The good news is that up to 80% of major strokes are preventable if early warning signs are recognized and treated in time. Yet every year, more than 240,000 Americans experience a mini-stroke without even realizing it, dismissing the subtle symptoms as something minor. In this guide, we'll break down 8 critical warning signs that neurologists urge everyone to recognize, especially those caring for aging parents or elderly loved ones. Stroke remains the 5th leading cause of death in the United States. Knowing what to look for, when to act, and how to respond could truly save a life. These are not abstract medical ideas. They are real warning signals from the body, and recognizing them could make all the difference. One of the most recognizable warning signs of a TIA is the sudden onset of weakness or loss of sensation, usually affecting only one side of the body. In medical terms, partial weakness on one side is called hemiparesis. A complete loss of movement is known as hemiplegia. Both occur when blood flow to the brain's motor cortex is temporarily disrupted, preventing signals that control muscle movement from reaching the face, arm, or leg. The affected limb may feel unusually heavy, unresponsive, or as though it has fallen asleep, but without any clear cause, such as awkward positioning. Here's a simple self-check. Stand in front of a mirror and smile naturally. If one side of your mouth droops or appears uneven, that asymmetry could be a warning sign. Next, raise both arms straight out in front of you. If one arm begins to drift downward on its own or feels noticeably weaker, seek emergency medical attention immediately. Unlike normal muscle fatigue after exercise, TIA-related weakness almost always affects only one side of the body and appears suddenly without prior exertion. Some people lose sensation completely in the affected area. Others experience a combination of weakness and numbness. Even if these symptoms disappear within minutes, they are a serious red flag and should never be ignored. When blood flow to the brain's language centers is disrupted, speech problems are often among the earliest warning signs of a mini-stroke. The medical term for this is aphasia, a condition that can affect your ability to speak, understand, read, or write. The brain's primary language regions, Broca's area and Wernicke's area, depend on a constant supply of oxygen-rich blood. During a TIA, that supply is briefly interrupted, causing sudden communication difficulties. You may know exactly what you want to say, but the words come out slurred, jumbled, or strangely distorted, as if your tongue simply won't cooperate. Some people describe it as trying to speak with a mouthful of marbles. This isn't the occasional struggle to find the right word. It's a sudden and noticeable change in your ability to communicate. In some cases, a person can hear others clearly, yet cannot understand what is being said. Doctors refer to this as receptive aphasia. What distinguishes TIA-related speech problems from gradual language changes seen in conditions such as Parkinson's disease is how suddenly they appear. There is no warning, and although the symptoms may disappear just as quickly, even a brief episode requires immediate medical evaluation. The medical term paresthesia refers to the prickling, tingling, or pins and needles sensation that can occur during a mini-stroke. Unlike the temporary numbness caused by sleeping in an awkward position, which fades once you move, TIA-related tingling is the result of reduced blood flow to the brain's somatosensory cortex, the region responsible for processing physical sensations. These sensations almost always affect only one side of the body. They often move in a wave-like pattern, beginning in the fingertips and traveling up the arm, or starting in the toes and spreading upward toward the torso. This progression reflects how different sections of the somatosensory cortex are temporarily deprived of blood flow. Importantly, changing your position or walking around does not relieve TIA-related tingling, which helps distinguish it from simple nerve compression. The affected area may also feel unusually warm or unusually cold compared to the rest of the body. If you or someone you love experiences sudden, unexplained tingling on one side, treat it as a medical emergency, not as a minor inconvenience. A mini-stroke can trigger a sudden mental fog, completely unrelated to ordinary forgetfulness or fatigue. Clinicians refer to this as an acute confusional state, sometimes called delirium. It occurs when blood flow to critical areas of the brain is briefly interrupted. The frontal and temporal lobes, responsible for reasoning, memory, and decision-making, are temporarily deprived of oxygen, and cognitive function begins to falter without warning. Imagine feeling disoriented in your own living room, or suddenly forgetting how to perform a simple task, like making coffee or dialing a familiar phone number. The confusion can take many forms. You may struggle to retain recent memories. You might fail to recognize the faces of people you know well, or you may find yourself unable to follow even basic instructions. Some individuals cannot recall their own home address or phone number, details that are normally automatic. What distinguishes TIA-related confusion from conditions like dementia is its sudden onset. It appears within seconds or minutes, not gradually over months or years. Healthcare professionals emphasize this point strongly. Do not dismiss sudden confusion as stress, exhaustion, or distraction. Doing so could delay urgent medical care, when every minute matters. Visual disturbances during a mini-stroke can take several alarming forms. One of the most recognized is amaurosis fugax, a sudden temporary loss of vision in one eye. Many describe it as a dark curtain or shade, slowly descending over their field of view. This occurs when blood flow to the retina or to the brain's visual cortex is briefly interrupted. Other symptoms may include double vision, known medically as diplopia. Some people see bright flashing lights or zigzag patterns, a phenomenon called scintillating scotoma. There may also be partial vision loss affecting the same side of the visual field in both eyes, referred to as homonymous hemianopia. All of these disturbances happen because the occipital lobe, the part of the brain responsible for processing sight, is not receiving enough blood. Unlike visual auras from migraines or simple eye strain, TIA-related vision problems usually affect only one eye or a clearly defined portion of the visual field. They appear suddenly, without warning, and although they often resolve within minutes, they must never be ignored. These are urgent warning signs, and they may signal that a major stroke is imminent. Dizziness caused by a mini-stroke is very different from the brief lightheaded feeling that can happen when you stand up too quickly. When blood flow to the cerebellum or brainstem is disrupted, the brain's balance system can suddenly fall into chaos. Clinicians call this acute vestibular syndrome, a condition that occurs when the brain's equilibrium centers are deprived of oxygen. Maintaining balance requires precise coordination between the eyes, the inner ear, and the body's sensory nerves. When a TIA interferes with that coordination, the result can be an intense spinning sensation, as if you are trapped on a rapidly turning carousel. Some people develop what physicians call gait ataxia, an unsteady, staggering walk that may resemble intoxication. In older adults, this level of dizziness dramatically increases the risk of serious falls. What separates TIA-related dizziness from common positional vertigo is important. It does not improve simply by sitting down. It is not triggered by specific head movements. And it is often accompanied by other neurological warning signs. Nausea or even vomiting may occur, but the defining features are its sudden onset and its severity. When dizziness appears abruptly and intensely, it should be treated as a medical emergency. Headaches are not the most common symptom of a mini-stroke, but when they occur, they are nearly impossible to ignore. Often described as a thunderclap headache, the pain reaches its peak intensity within seconds, unlike the gradual buildup of a typical tension headache or even a migraine. During a TIA, the brain's blood vessels experience rapid fluctuations in pressure and flow, triggering what neurologists call a sentinel headache, the brain's alarm system signaling vascular distress. This type of headache may come with photophobia, sensitivity to light, or phonophobia, sensitivity to loud sounds. What makes it particularly concerning is that TIA-related headaches rarely appear alone. If a sudden, severe headache strikes alongside dizziness, visual disturbances, or numbness, this combination is a medical emergency. Immediate evaluation is critical. A sudden brief loss of consciousness during a mini-stroke is known medically as a syncopal episode, or in some cases, transient global amnesia. Unlike fainting caused by low blood pressure or dehydration, TIA-related loss of consciousness happens when blood flow to the brain's arousal center, the reticular activating system, is temporarily interrupted. These episodes may last only seconds, yet they carry serious implications. Before fully losing consciousness, a person may feel as though their vision is graying out, rather than experiencing a complete blackout, a warning state called pre-syncope. Some individuals wake up confused or disoriented, unsure of what just occurred. During these moments, oxygen levels in the brain drop below what is required for normal function, causing non-essential processes to temporarily shut down, protecting vital brain activity. Even if the episode is fleeting and the person appears to recover fully within moments, it must be treated as a serious neurological event. Any unexplained loss of consciousness, no matter how brief, demands urgent medical evaluation. Mini-strokes are medical emergencies. Full stop. Each of the 8 warning signs we've covered demands immediate medical attention. The most dangerous response to a TIA is a wait-and-see attitude. Every minute without treatment increases the risk of a full, potentially debilitating stroke. Remember the FAST acronym as a quick guide. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call emergency services. If you, or someone near you, experiences any combination of these symptoms, call emergency services immediately. Do not drive yourself. Do not wait to see if the symptoms improve on their own. Early recognition and rapid intervention are the most powerful tools in stroke prevention. Share this information with family members. With elderly relatives, it could save a life.